to provide the necessary workshops. So as you can see below, we have our panned out schedule. Keep this in mind if you're thinking about participating in any of the workshops. So for Q1, we have January through the month of March. We're looking at participating or actually planning out 8 workshops. We actively have 2 that are in play right now, and they are both full. Thank you so much. Our target dates, of course, are from January to March of 2026. So we will be holding workshops through that same time. Again, we want to maximize the leaders' availability. So actually, I'm working on trying to schedule more workshops at this time. In Q2, of course, April through June, we're looking at trying to schedule another 6 workshops. We do have to consider that there are holidays and weather changes as well. So we're trying to get as many in as we can without too much overlapping of the dates. And then in Q3, which runs from July through September, we're looking at doing another 6. Now, some of this may change depending on the flexibility of our trainers and the availability to get more on board to help us host these workshops. So that would run through the end of September, which would actually be the contracted year. The workshop delivery. There is a number of sessions that are required for each workshop. By phone, it would be 6. Virtual, the number of sessions would be 6, and also in person would be 6. What we've been doing is a kickoff session, and some of us have participated in already scheduled events with the host site. So that was our ground zero, where we do a brief introduction of the workshop. And actually, that's been very encouraging because it allowed us to sign up quite a few people and get for them to be introduced into the Living Well workshops by SMRC. The time per session in person is 45 to 75 minutes. There are breaks included, of course. Virtual is 2.5 hours per week. And then in person, the sessions are 2.5 hours, so 2.5 hours. The number of participants that can attend over the phone is 3 to 6. Virtual, of course, is 8 to 12. And then in person, it's 8 to 14. We have actually been exceeding that number. And so we have to, the ones that we have going on right now, both diabetes as well as chronic disease, they are both to the max. Very proud to say that. As far as our number of peer leaders, of course, for the one done over the phone, it's 1. We will need 2 facilitators or peer leaders for the one that is virtual. And then also in person, we have 2, and then we have a coordinator to assist. As far as materials and equipment required, there is a script and a toolkit that's provided over the phone. As far as a living and for the virtual, living healthy life and chronic disease book that they can follow along with. And then in person, we have toolkits, we have books, we have CDs, of course, and then we have charts that we review and go over during the session. It's very interactive, very interactive. Next slide, please. As far as our work implementation, we have worked alongside our host sites as well as with DC Health and its peer leaders. So again, we have peer leaders up to 6 that are currently available who can run multiple workshops. And right now they're running side by side. We have 2 that work on Tuesdays and another that works on Wednesdays. We're actually trying to get one started on Friday. We have our master trainers. We have 2 that are available to support our training, our peer leader trainings with fidelity checks and any troubleshooting. They have been very valuable to us. As far as materials, we have an online platform. Our teams work for virtual as well as phone if necessary. And then we also have participant registrations, and that we've been doing those live. As far as our host sites, we have great partnerships with them. We have identified points of contact, again, that is outside of leadership in the event that we need to have sites set up and things of that nature. We do know leadership tends to get busy. So we ask for a special person that's considered a point of contact that is not leadership. So in the event that our team needs them, we're able to get them at that point. We also have open space. The open space we use to make sure that everyone has their own room so they can exercise. More importantly, they have the freedom to participate and be active in the workshops. been very helpful. So in each one of the workshops, we have a very open room where we can put posters up, people can share their ideas, people can get up and move around. It's been very interactive as well as productive. Working along with our DC Health team, of course, we have peer leaders for them. We have master trainers. Then we've also worked with them as far as materials, an online platform via WebEx and virtual phone delivery. And then we also have technical assistance when provided. So together as a team, it's been a wonderful transition for us to get this up and started. And we've had success so far. And so we'd like to spread this across the community. As far as our workshop implementation process, I'm going to go over that with you as far as steps. At first, we thought, well, how do we start this process? So we had to take a look at it and understand what our objectives were and what our goals were. So we partnered with our submit workshop types, mode, and dates and times. We had to look at that and see what the availability was. We actually confirmed with the workshops on who we could reach out to and who actually had the capacity to hold a workshop for that many people. You know, as we know, some community-based centers are not very large, you know, or have that. So we had to make sure that the centers would be able to hold a wide range of people and also contain the workshops and the necessary equipment needed. We confirmed workshops and sent implementation timelines to our partner organizations to make sure that they would be able to accommodate those days for such a long period of time, especially because it was not just one workshop that we did and then it was over. It's actually a series of 6. And we also want to continue to do this in those comfortable workshops or comfortable sites over a 6-week period. So we then partner with the organizations, and we also work to recruit and register participants in the workshops. And how we did that was we actually participated in an event that was already going on, or either an active day within those host sites. We were able to introduce what the project was and what the workshop consisted of, and the perks from it. In other words, what could the participants gain from attending the workshop? Once we did that, we were able to sign people up right there on the spot. A lot of people were very excited about the opportunity. More importantly, that this workshop would be available somewhere that they already frequent. So they wouldn't have to drive far or go far to participate, but that we would actually be participating right there on the location that they were already comfortable with. So we had pre-workshop meetings. We held meetings with the community partners so they would get a really good understanding of what the process was going to be, what they could expect. And then we also went over some of the materials with them so they would be well aware and can help us answer any questions that the participants may have. We then implemented the workshops. We originally wanted to kick them off at a certain time. We looked at the date and the time, made sure everyone was aware of it. We actively worked with the partners, of course, to create flyers, make sure everyone was aware of the date and the time. We wanted to make sure that they knew that since it's a 2.5-hour item, that we would prepare snacks, have snacks for them, but we would make it a comfortable environment for them to roll out. Okay. So we also wanted to, next step, collect the data of those who wanted to register, let them know that we were going to have surveys that we could submit to DC Health so that we can get a general understanding of what were some of the member or participants' concerns and what they would like to gain from a workshop. And then also, Wealth Century DC provided participation, and after the completion of the workshop, we will provide gift cards with all of those and a certificate. Everyone loves to get certificates. So they will, if once you've completed the workshop, you will then receive a certificate as well as a gift card for the number of sessions that you participate in. As far as recruitment, we recruited DC residents. Again, we wanted to prioritize the wards 5, 7, and 8, who are interested in healthcare education and or who have chronic healthcare issues. We also wanted participation in the workshops, or we know that participation in the workshops is crucial to ensure that the program achieves its objectives and also creates a lasting impact on the community. Again, we want to continue with the engagement and make sure that everyone is aware that this opportunity is out there for them. We also identified host sites based on our existing community partnerships and our collaboration with leadership to coordinate site visits. Now, we wanted to do that because we've been in the community. We've worked with a number of the community-based organizations. So we got a feel for some of the partnerships that we had and who has the ability to host such a large workshop, but more importantly, who is available to the community and who could benefit most. And so that's what we considered when we identified the host sites. We also assigned a coordinator from WellCentric who would work with a designated point of contact for each site. Again, we wanted to make sure that we had a comfortable engagement, that everyone was well aware of what was going to take place, and to create a cohesive team so that when we roll the workshops out, we were there to support the trainers, but also to provide a level of support to the participants as well. We also engaged in a schedule of community-based activities. So there were already activities on the calendar for the host sites. We wanted to make sure that we attended, we were readily available to answer any questions that they had, and we could explain the content of the workshop so that we can engage members to participate and let them know about the healthcare outcomes, or educating them on healthcare outcomes. So that was part of the recruitment. We wanted to, again, identify the host sites that were in the community. We wanted to look at the ones who could best provide us with a nice group of participants. Then we also wanted to identify resources within the site that we could work with to make sure it was a successful workshop. Again, we wanted to keep the community engaged and also participate in an area that was welcoming to the DC residents. Next slide. The benefits of being a host site. Now, some of you may be interested, of course, but we wanted to let you know of some of the benefits that you can gain from hosting these wonderful workshops. Some of the incentives, of course, the workshop and materials are provided at no cost to the site. Everything we use, or the materials that we have, there's no cost to the host site. We have a package of supplies that we bring. We just utilize your space. We, of course, another incentive, and this is huge, is it strengthens programs within the community and your service. It definitely creates an impact on the residents. It increases community engagement by delivering evidence-based healthcare programs that enhance residents' well-being. It also evaluates organizational reputation, or elevate organizational reputation as a wellness-driven, community-focused organization. It also improves resident health and wellness, by particularly in chronic disease management. There are also benefits to the participant. Benefits to the participant include incentives, such as materials are provided at no cost for the participant prior to the workshop start date. There's also light snacks and refreshments during the workshop. There's also a certificate upon completion, as well as gift cards provided during the final session. So those are the immediate incentives. It also promotes better health management. You get to learn about practical skills to manage chronic conditions and improve overall well-being. You also gain confidence and empowerment. You gain tools to take control of health decisions and daily challenges that you may meet from these chronic diseases. There's also a social support and connection. We build relationships and share our experiences in a confidential space with others who are facing similar health issues with us. And that helps to open up the communication and dialogue. The best thing from this is it also improves communication. It strengthens the interactions with healthcare providers and caregivers. And again, it opens up the discussion. People tend to be more free and open in a community setting with people who are sharing the same experiences. And sometimes that's what it takes for people to open up and share their experiences and learn different things that are valuable to their health as well. And those are some of the wonderful benefits of being a participant. As far as our current and upcoming host sites, we try to, again, select those that we had community relationships with, but then also those who provide services to the community and the communities in which we service. So we actually have NYA Health Services on Rhode Island, and they actually service wards 5 and 7. We have also Inspire Consulting, and they are on Nanny Helen Burroughs. And then we also have two that we are currently working out of right now, and that is Total Family Coalition, and that is 1229 G Street. And again, these two workshops are full to capacity at this time. We also have UPO, United Planning Organization, and they are out of the Greenleaf Center, and that is on 1200 Delaware Avenue. Those two locations, we are actively holding workshops. The one today had to be postponed due to the weather. The one tomorrow is our diabetes workshop, of course, and that one is very popular. We are definitely at the max for that as well. And that one will be going on tomorrow. I found out that the center will be open for the workshop, so we're excited about it. We also have additional services or sites that we are working with, and that is Abundant Grace, and they are on Benning Road. Also, So Others May Eat. Our plan is to do a diabetic workshop with them in middle February, and so we will be rolling that out. We will make those dates available to those in attendance on this call. And then we also have Spaces in Action, which is one of our Latino populations, and so we want to make sure we reach out to them as well. And that one is currently in planning as soon as we identify facilitators for that. If you're interested in hosting a workshop or you have any questions that you want to share with us or any ideas, you can contact us at WellCentric Health Group, doing business as WellCentric DC. We also have an email address. It is info@wellcentricdc.com. We are located right in the Navy Yard area at 1100 New Jersey Avenue, Southeast. We're in Suite 710 in Washington, D.C., 20003. Or you can contact me directly. Again, I am Felicia Sears. I am the program administrator for this project. I'm very excited about opportunities for it. You can reach me by email if you'd like at felicia.sears@wellcentricdc.com. And then we also have Nettie, and she is our community program coordinator. And again, Nettie's email address is listed. It's nettie.bizet@wellcentricdc.com.
Thank you so much for sharing, Felicia.
You're welcome.
That was great. So now we'd love to hear from all of you, and we'll open up the floor for some discussion. We can get started with some of these questions. Please feel free to come off of mute or go ahead and add in the chat. Just a couple of questions to get us started. Do you have programs focused on self-management, or is most support provided through direct clinical care? How important is it for your organization to offer community-based peer-led workshops? Do you have existing partnerships with community organizations, senior centers, or health systems for outreach? And do you have staff or volunteers who could be trained as peer leaders for workshops? Also, any questions you all may have for Felicia and the team, please feel free. And I actually do have a question for Felicia. Felicia, you mentioned that you have upcoming sites that you're working with currently. If I'm at a CBO or a healthcare center and I have a patient I'd like to refer them to, what is the best way to do that? Is it just to send you an email and say, hey, I'd like to send this person over for the self-management workshop? Or, yeah, what's the best way, I guess, since you mentioned some of them will start in February?
Yes. So if you are interested, we do have Nettie there. Nettie is our program coordinator, and so we are working on those workshops. Once we secure those dates for the next ones, because the two we're running right now are full, then Nettie can get them enrolled in one of the locations. So if you would like to, if you have any members to any provider groups or what have you, if you have anyone that may benefit from this or if you're interested, whether it's diabetes or chronic disease, email Nettie that information. Her email address is included in the deck, and let her know, as well as the facility that you're sending it from. She'll need their name, their email address if they have one, and their phone number.
Perfect. Thank you so much.
You're welcome.
I'd also like to let everyone know that we will be adding Willcentric and the team into Link U, just to make sure that for the referral cases as well. So if you do plan on having anyone that could benefit from one of the workshops, it might be easier to just streamline through Link U and have them available there. So that will be coming soon.
Mm-hmm. And we are very excited about that opportunity. I was introduced to Link U over this early this last year. It's a very valuable tool. And so as we grow, we're going to list some workshops in there. Someone will be able to go on, see what the workshops we have, and sign up via the tool. So you'll have more than one way to do so. You can reach out to Nettie and myself. If you're a host site, you can reach out directly to me. We can talk about what the location is. We can have Nettie come out and do a site visit. And then if you have someone who wants to attend the workshop again, make sure that you email Nettie their information as well.
Perfect. Thank you so much. Any other questions from anyone? If there are no questions, we'll go ahead and move forward with some closing announcements. We'd like to thank everyone for sharing insights today. As we wrap up the session, few quick announcements to share before we close out. For our partners, does anyone have any announcements or upcoming events they'd like to share with us today? And again, today's session will be shared and available soon on our Living Well DC website, which is livingwell.dc.gov. We'll post that under the Community of Practice webinars. Our next session will be on Tuesday, March 24, 2026, again from 2 to 3 p.m. So no session next month. So we'll see you all again until March. And if there are no other questions, I would like everyone to please take a moment to complete a quick evaluation poll. I'm going to go ahead and launch it right now. And hopefully it comes up for everyone before everyone heads out for the day. Please answer the 3 questions on there. And you are free to go once you're done with that poll. I want to thank everyone and hope everyone has a wonderful rest of your day.
Thank you so much.
Thank you, guys. Again, utilize the information. If you have any questions, we'll be more than happy to assist. Thanks again.
Thank you, Felicia.
Take care.
You're welcome.
Thank you. Have a great day. Bye-bye.
Thank you, everyone.
Thank you.